Can you believe that a state in the US is now blocking the promotion of COVID vaccines? Incredible. Can you believe the turnaround? And it's not just COVID, it's flu and monkeypox as well. And I've got here an article to show you just what it is that they're talking about. This is from NPR, and this is their article here. And this was published on the 20th of December, 2024 by Rosemary Westwood. And it's speaking about the fact that Louisiana forbids public health workers from promoting COVID, flu, and monkeypox shots. Wow, that's incredible. Now, I'm one of those people who did think that they made some mistakes, but I'm not anti against the vaccine because I know who could have gotten benefit from it. I know who could have not gotten benefit from it. And so, therefore, if you use your knowledge scientifically wisely, you can help the best people take an intervention without completely throwing out the baby and the bathwater. But here is what they said. A group of high level managers at the Louisiana Department of Health went into a November 14 meeting talking about community events, and they were told that advertising or otherwise promoting the COVID, influenza, or monkeypox vaccines, an established practice, and at most other public health entities in the US, must stop. Again, that is incredible. Now, who would have ever believed that we could have seen such a turnaround in relation to this? But you have to understand what is happening here and why this is occurring. So, again, I'll show you what they said later on in the article. This policy change occurred after the new governor's election. So, the Louisiana governor in early 2024, Republican Jeff Landry, he was the state's attorney general for 8 years. And during the pandemic, he criticized the state's COVID response and filed lawsuits over federal and state vaccine mandates. This is where the problem is coming. Now, as usual, there is an overreaction where people go either one way or the other. It doesn't seem as though, and these days, anything can be nuanced and can be reasonable. It's almost as if there is always going to be one extreme response, one way or the other. Because there's no doubt that, as I explain to people very often, once you understand that the COVID vaccine was designed to reduce the risk of severe COVID 19, you then start to understand the science because who was at risk for severe COVID 19? People say everyone. No, it's not that a random person couldn't get it, but we knew pretty clearly who was at highest risk for severe disease. And it wasn't a slight difference, it was a massive risk difference. In the older people with comorbidities, obesity, we knew who they were. And this is why in the pandemic they were vaccinated first. The issue comes about with what happened with vaccine mandates afterwards in low risk cohorts and even in people who had already previously been infected if they then went on to have any issues. Those are where the problems and the questions need to be asked. Now, because it seems there is a change in leadership, and it seems that there is ongoing circulation of virus, and it seems that the population is no longer as amenable to listening to public health leadership, you are now having people going in a different direction with regards to responses, and they're almost going too far the other way. I'm going to play a clip here, and this clip is from Sean Kaufman, who is a public health professional as well. And he made some pretty clear thoughts with regards to his view as to what had happened in terms of the pandemic. And he is very nuanced and very clear. Listen to what he had to say, and you'll understand my perspective as to how this should be addressed.
If I can, first and foremost, there's something that you said really struck me and bothered me as a public health professional. Public health does not tell people what they want them to do with their bodies. Public health actually empowers people to do what they feel is best for their bodies. And public health is also the source that people, we give them the information so that they can determine what is best for themselves and their families. Public health cannot assume what is best for anyone and everyone, and when it does, it is wrong to do so. And so, in your statement, I again, if you want to get a booster, I think public health needs to be a place where you can go to get it. And if you don't want to get a booster, I think public health needs to be the voice against getting it. And what I mean by that is we serve the general public. That's our customer. We don't tell the general public what to do with their bodies or with their lives. And that's where we made a huge mistake during COVID, is doing that. What we do is we give them good, sound information in a way that they can understand it and allow for them to make the decisions that are best for themselves and their families. That is what public health does. Public health doesn't dictate what people need to be doing, certainly not with a booster or a COVID-19 vaccine or any other medical procedure for that matter.
So that's the view from Sean Kaufman. And as I said, that is very nuanced, very logical, very clear. Public health is there to support, educate the public, help them to understand the science. So if I had come across that person early in the pandemic who was very anxious about COVID vaccines, they were overweight, they were over 65, they had heart disease, diabetes, and they say, listen, I am afraid to get it. You just explain to the person very simply, it's all about risk and benefit. Whilst you may be concerned at that time about the risk longer term, in the current situation, if you have high risk factors and you've never been exposed to the virus, it makes sense to therefore do an intervention that, yes, you could argue you don't know the full long-term risk, but you know what could happen in the context of the virus. And if you explain that clearly to someone and they understand, most people will then say, okay, I understand. I can see where there's benefit here. I may do it. But you may still come across people who have a very strong view with regards to what they wouldn't do. And we see this all the time in clinical medicine. And what you then do is, if you've educated the patient, you've given them informed consent, they don't want to do something that you think is beneficial, you say, okay, how else can we support you? What else can we do to try and protect you? And what should have been happening is, if they had those people, then that's when you would say to them, well, listen, make sure you're optimized from your health point of view. Make sure your levels of, say, vitamin D are well up to date in case you get exposed. Maybe you could consider taking an antiplatelet, whatever it is that you thought could be beneficial to the person. That is what you would institute. Again, as I said, that's how medicine works, and that's how public health should work. The patient who has had a heart attack and is insistent that they're not going to stop smoking, you don't stop treating the patient. You try and negotiate. You say, listen, if you're going to continue smoking, I want to make sure your blood pressure and your diabetes are under perfect control. And you negotiate with them. That's the role that public health should be doing, educating people, understanding them, and critically having multiple options available so that they can guide them through the process. That's medicine. That's what should be done. It's harder work. It's much easier to just tell people to do what you want them to do. If that was the case, I would have probably stopped the smoking problem a long time ago. But you can't do that. I'd have the same issue with alcohol. If you look at how much damage alcohol causes, if that was the case, then you just ban it. It doesn't work like that. You interact with people, you help them to understand the risks and the benefits, you try and guide them, and you support them in their decision. And so when you have the situation here, as what is happening in terms of Louisiana, so the new ban on vaccine promotion represents a new level of political interference, according to two current health department employees. We've never felt so unsure of our future. Like, why am I here? What am I doing anymore? Because you're so stifled, you are not helping people. Now, I understand their frustration, But then you have to ask the question, were they also one of those people who was pushing the mandates? If they were pushing the mandates on people, making them lose their jobs, making them lose their livelihoods, they shouldn't be in those positions, because they may do it again if they're afraid with regards to some other virus. So these are the people who would then overreact potentially with regards to bird flu, not looking carefully at the science to work out, if you're going to vaccinate the population, who do you give it to? When do you give it to them? How do you minimize the long-term risks? Those are the kinds of questions that need to be asked. And so one of the reasons why people are feeling so anxious about what is happening, say in Louisiana, is that their position is being threatened. They don't know what to do. They don't know where to go. And as we say towards the end of the article, you can see here that they're worried that they're not promoting enough of the flu shots. You cannot ask people, hey, we have flu shots. Would you like one? Well, in any case, why are you saying that to a random person? That's not what you say. You say, listen, are you at risk for severe flu? And if you are, have you considered the flu shot? Have you had it before? Did you have any reactions that were negative? Maybe this is something that should be of benefit. That, if that's the kind of promotion that's being done, no wonder this is being restricted. However, we don't want the pendulum to swing the other way. And that's the problem, is that you have to be careful. In the same way that mistakes were made on one side, you don't want to go to the other extreme and completely dismantle faith and trust in vaccines. I think the public are sensible and nuanced enough to understand that vaccines are extremely beneficial. What they seem to be concerned about is the extent that they're being used, and the fact that it appears that it is just being used without the nuance, making sure that the people who are getting it are actually the ones who will receive the benefit. That's the kind of science that we want going forward. It's harder work, I agree. It's not as easy just put on a mandate. But the truth is, I think those days are done. And we need public health professionals who can handle that transition and help people to make the right decisions for themselves. Thank you.